Mental illness is common, with 1 in 2 Australian adults expected to experience a mental illness in their lifetime. This means that every day millions of Australians go to work while experiencing a mental health problem. The impact can be enormous, both on the individual and the workplace, presenting challenges for staff safety, morale, performance and productivity. More and more workplaces are realising the importance of managing mental health at work, the benefits of improved mental health literacy, and creating a culture of care where all employees feel supported and encouraged to talk openly about mental health. Mental health first aid training has been identified as a practical tool for creating a mentally healthy workplace, and many businesses now use the training as part of their broader health and wellbeing strategy. As well as supporting staff to complete mental health first aid training and become an accredited MHFAIDA, many workplaces are now appointing mental health first aid officers and establishing workplace support networks. A MHFAIDA is someone who has completed a mental health first aid training course. In that course, an MHFAIDA will learn about the signs and symptoms of mental health problems, how to recognise and respond to an emerging and worsening mental health problem, and the intervention and supports available. Using the Mental Health First Aid Practical Action Plan, an MHFAIDA learns the skills to approach a co-worker or another adult that they are concerned about and how to initiate a conversation about those concerns. Having mental health first aid skills means that you can assist someone in your life, providing support when it matters most, and making a real difference to your workplace or community. MHFA officers have completed the mental health first aid training and completed the short post-course assessment to become accredited. Equipped with the skills and confidence to offer support to another adult in the workplace, they are formally appointed by their workplace to act as the initial contact for trusted peer support, assistance and referrals. Being an MHFA officer is the ideal role for people who are passionate about mental health, the well-being of others and developing their skills in the workplace. MHFA officers are committed to these additional duties and can escalate matters if required in an efficient and appropriate way in accordance with their organisational policies and procedures. It's important to note that MHFA officers are not substitutes for professional services. Instead, they empower and assist employees to seek the support they need. The primary difference between an MHFAIDA and an MHFA officer is that an officer has been formally appointed as a designated resource to provide initial mental health first aid support within their workplace. The support an MHFA officer provides is outside of HR and health and safety teams and acts as a valuable complement to formal workplace support services such as employee assistance programs. Some organisations choose to train all their employees in mental health first aid to help create an environment where everyone has a shared understanding and language around mental health. Others take a more strategic approach where they choose who would be best suited or where the skills are needed most. There is no formula to calculate how many MHFA officers you should have, but a general rule of thumb is to have the same number of MHFA officers as physical first aid officers. For many workplaces, appointing an MHFA officer has helped strengthen their workplace culture, improving retention and engagement. It also helps send a strong signal that the organisation is committed to prioritising mental health and creating a workplace culture where staff feel encouraged and supported to talk openly about mental health. Once staff have completed mental health first aid training, a workplace can look at appointing an MHFA officer. There are several ways to go about this. A workplace can choose to identify and approach someone who has the right skills and disposition, or they may introduce an expression of interest process and ask accredited MHFAtors to apply. Irrespective of how you appoint an MHFA officer, it's important to look for diversity in the role and have accessible MHFA officers across different teams and sections of the business. Consider culture, gender, age, level of seniority and roles when appointing an officer. Making these considerations will help improve the likelihood that a person experiencing a mental health problem will identify with someone in the organisation that they feel comfortable talking with. The role of an MHFA officer can often be emotionally demanding, so providing support is essential. Many workplaces opt to have a dedicated central point of contact available to an MHFA officer for debriefing and ongoing support. Many also ensure that there is a clear escalation process and that MHFA officers have the full support of their manager who understands the description, requirements and commitment of the role. Once you've appointed MHFA officers in your workplace, you may want to consider getting your workplace recognised for your efforts. Mental Health First Aid Australia's Workplace Recognition Program recognises and celebrates workplaces for their commitment to MHFA training and their investment in mental health literacy and first aid skills of their people. It acknowledges workplaces who embed mental health first aid training into their organisational culture and create mentally healthy workplaces. We've developed a suite of resources to assist mental health first aid officers in their role, including position descriptions and tips on how to set up a mental health first aid officer network for your workplace.